I look at the quality metrics that we use today, the HEDIS metrics, and they're so, process measured, and they're
Hmm.
such things that people don't really care about. They don't really care about the idea of whether I got my well visit by itself is not a satisfying thing for me as a mom to think about. It's really, I want my child to be healthy and learning and thriving. And so how could quality metrics shift more to measures of things that people really care about as an older person, your true mobility. And I would love to see us figure out how healthcare providers are truly incented to measure those things and use that as the barometer of success and integrate that into value-based contracting
Yeah.
where there's more alignment. Part of the issue I see is that you've got so many separate entities. You've got hospital entities, health provider entities. And if we could have greater integration of the financial incentives of those organizations in delivering care that aligns with what outcomes people really care about, that's what I would love to see in 2030.
Yeah, I think that's amazing. When I first started in the ACO world, like the traditional Medicare world, it was the whole point was to keep people out of the hospital, right? To lower the cost and
Mhm,
improve
mhm,
quality.
mhm,
But when you're attached to a health system, like you're
mhm.
saying, the heads in beds was what what was the margin
Mhm,
was expected on the hospital side. So you're in complete contrast with each other. And I feel like in the last 15 years, things are getting better, but they're not
mhm,
completely aligned. Like you're saying, we are
mhm,
we are not truly in the healthcare space. We're in the sick
mhm,
space. Like
mhm,
let's,
mhm,
figure out how we can help the sick people, but
mhm,
we're
mhm,
needing to move more towards
mhm,
healthy. And the last thing I'll say about that too is we talk a lot, or I especially talk a lot with our clients about making sure that they understand the spirit of the measure. I used to make fun of that
mhm,
statement, but now I use it all of the time.
mhm, mhm,
Like what is CMS really trying to do with these measures?
mhm,
And we have health outcome surveys, which is, very Medicare in depth, but their CMS is trying, right? They're
mhm,
trying to
mhm,
get to where we
mhm,
can measure outcomes versus those process measures. But
mhm,
it does, we had to like wedge people in or like
mhm,
step by step to
mhm,
get, but it's been a
mhm,
long enough time that we've been measuring breast cancer screening. Like, what are we
mhm.
doing with those screenings?
Mhm.
What are we
Mhm.
doing with the
Mhm.
wellness exams?
Mhm.
But
Mhm.
yeah,
Mhm.
I
Mhm.
completely,
Mhm.
completely agree.